I like to start my talks by saying things somewhat controversial, just to keep you engaged and to see if you disagree. So I'm going to say a statement, and think to yourself if you agree or disagree, and I'll try and create an argument to show you why I believe it's true. Physical appearance matters. Okay. It sounds controversial. It sounds almost vain, right? When you see that statement, you think vanity. But why is that true? Well, how much do you think Americans spend each year on cosmetic procedures? Billions. It's about $12 billion per year. That's just cosmetic procedures. How much do you think that Americans spend on cosmetic products? Close to $40 billion a year, okay? And this is statistics from just a couple of years back, the most recent data, and it probably is more than that. Why? I think that there's 4 reasons for this. First is relationships. There's a quote that I like to quote from a scientific article talking about evolutionary biology. It says, individuals of high phenotypic quality are more likely to find mating partners than their lower individual counterparts. It's sort of sophisticated, but it's basically a way of saying someone who looks like George Clooney is much more likely to have success at relationships and mating than someone like me. And it's one of... Perceived health is another reason why. There have been studies to show that those who have blemished skin are more likely to be perceived as older and less attractive and less healthy. Compensation is another topic. This is somewhat controversial, but a man named Daniel Hammermish came to visit us right in this auditorium last November. He's an economist from the University of Texas at Austin. He studies a thing called pulchronomics, or the economics of beauty. And he's done basically his career has focused on showing that those individuals who are considered more attractive wind up making more money at their jobs. Over the course of a lifetime, how much do you think that equates to? About $250,000 for someone who's attractive versus someone who, from an objective perspective, is considered less attractive. The final point is happiness. There's one study to show that individuals that are considered in the top 15% of attractiveness are or wind up being 10% more happier than those who fall in the bottom 15% of what would be considered attractive. Now, there are a lot of cosmetic procedures being performed. I'd say that the 2 specialties that perform the most cosmetic procedures to try and improve appearance are dermatologic surgeons, dermatologists, and plastic surgeons. I'm a member of the American Society of Dermatologic Surgery, and you can see the statistics. It's quite a number of procedures. I published an article a few years back that showed that cosmetic procedures have skyrocketed since the year 2000, and the main reason is because of minimally invasive cosmetic procedures, botulinum toxin, soft tissue fillers in particular. But it's important to go to someone who is comfortable performing these minimally invasive procedures. The photo on the left is a patient who came to see me a few days after she had been injected at a cosmetic spa, and hyaluronic acid was placed in an area where it was placed too superficially and too much. I was fortunate enough to be able to inject a product to dissolve it, but this photos show you that if you do seek cosmetic procedures, whoever you seek, make sure that you've vetted them, they're comfortable performing the procedures, they know their anatomy, and they're well trained. Many of you out there are my patients, and I appreciate the fact that you've come here to listen to this. Many of you may not know me, but let me introduce you to myself. I'm from New York, and I went to medical school at SUNY Stony Brook out in Long Island. I then did my dermatology residency training at Georgetown University. After dermatology residency, I went and did an advanced dermatologic surgery fellowship in Portland, Oregon at the Oregon Health and Science University. And there I trained for Mohs micrographic surgery, cosmetic dermatology, and laser surgery. I've been fortunate enough, I've been blessed to be an assistant professor here at the University of Pennsylvania since 2010. It's the oldest dermatology department in the country. It's been around since the 1870s. And there have been just an amazingly huge number of dermatologists here that have advanced the specialty. So I find it to be a privilege to be at this institution, and I do my best to hold my weight here. The majority of my practice is Mohs micrographic surgery and surgical reconstruction, which really focuses on skin cancer. Now, skin cancer is really prominent. There is more than 2 to 3 million skin cancers in the United States per year. over 120,000 melanomas if you consider the melanomas that are very superficial. One person dies of melanoma every hour. Okay? It's real. How can we avoid melanoma? Well, sun protection and sun avoidance are the most common ways. But unfortunately, folks do get skin cancer. And I apologize in advance, but skin cancer is real. And patients can get skin cancer, leaving defects like this. So this is a gentleman who I removed his skin cancer. We focus not just on getting the cancer out, but restoring patients to their original appearance. And this is something that I'm passionate about, and I'm fortunate enough, my colleague and mentor, Chris Mill, is here as well. This is something that within our division, we truly place an emphasis on restoring appearance. So this is a gentleman who had multiple stage reconstruction, and you can see on the right his post-operative appearance. Younger patients can get skin cancer. It's not just patients who are older. This is a younger female who we wound up doing a skin flap from her cheek, and here she is in the post-operative period. And then very younger patients can get skin cancer. This is a patient in her late 20s. So it's something that we don't want to see skin cancer. We'd like to avoid it, but if you do get it, we can help. The second focus of my practice is cosmetic dermatology and laser surgery. Now, we started the talk by basically discussing something controversial, and I'll circle back around to that. The thing that I really want everyone to get from this talk is just two important points, right? The name of the talk is tips on how to take care of the skin and why to take care of the skin. Well, how to take care of the skin, there's just two essential principles. And if you get nothing else from this lecture, remember these two things. They're simple and they're inexpensive. If you want to maintain skin health, if you're smoking, please stop. Okay? Why? Here's a photo from twins. The twin on the left did not smoke, and the twin on the right did. And if you had to look to see who you would grade as older, these folks are the same age. They have the same DNA. It shows you the environmental influences of toxins. Second, simple, inexpensive way of keeping skin health is to wear sunscreen. What's the best sunscreen to wear? Shout it out if you know it. We've got, okay.
30.
Okay. So we got a couple of brands, a couple of different numbers. Why do you want to wear sunscreen? Because you can see here, the person that has been protected from the sun, again, is likely to be aged viewed as younger. But the best sunscreen is the one that you will use. So we had multiple different name brands out there, and it's not pedantic. It really is. If you can put on any sunscreen, we would like you to do that. If you had to really be discriminating, there's just three things that you can remember on which sunscreen to use. Make sure that it has at least an SPF of 30. A 15 is pretty good, okay? 30 is better. 50 is really not that much better than 30, okay? And there's sort of esoteric description of why that is, but the bottom line is it's the law of diminishing returns. 30 is pretty much all you need to block out about 94% of the ultraviolet rays, okay? We also want you to wear a broad spectrum sunscreen, which basically blocks out UVA and UVB. UVB, you can think of as bad. It's the ultraviolet light that sort of causes DNA mutations and more likely to cause skin cancer. UVA, you can think of as aging. It penetrates deeper into the skin, impacts the collagen, and is more likely to cause wrinkles and aging. And then finally, you want to make sure that there's one that's water resistant. So it'll last through exercise and sweating as well as swimming. I like this slide because it really hits home on a point, right? This is a bedazzled cell phone cover. We protect the things that are most trivial. Why are we not protecting the thing that really matters the most? All right. So we're going to hit a little segue here. We focused on the two principles. You wear sunscreen and you stop smoking. But that's not the end-all, be-all, right? There are other ways in which we can improve skin health. And this is a pyramid that I like to sort of counsel my patients on, that the surface area that each of these blocks takes up is how important it is to maintain skin health. So at the very bottom, the core, the cornerstone of healthy skin is sunscreen use. And you can see on the left, you want to be using this from birth indefinitely. And then once you hit your 20s and 30s, and we have a diverse audience here, folks in their 20s and 30s, topical retinoids, specifically the prescription retinoids, have been shown to slow the signs of aging and may even improve very early signs of aging. As you mature a little bit more, we tend to see patients for minimally invasive procedures, things like chemical peels, lasers, injectables such as botulinum toxin and soft tissue fillers. And then there's a point where the face ages, where many of those minimally invasive procedures don't gain as much of an improvement as we'd like. We have a great number of other surgeons within our institution that if you have those signs of aging, I will refer you to them, because things like facelifts and eyelid lifts are really targeted ways to improve skin that is not likely to respond to the less invasive ways. So let's talk about prescription retinoids. This is something that a review was recently published in the Plastic and Reconstructive Surgery Journal, which shows that signs of skin changes can occur on the left, and then on the right. You know, the histology here probably doesn't make much sense to you, but what the retinoids do is that they change the thickness of the epidermis and they change the collagen underneath. But you do need to be applying them for prolonged periods of time. So if you put it on for a week or a month, it's not likely to show visible changes. The first 6 months is really where a lot of these changes take place, and then you need to use it indefinitely to see those changes persist. Now let's move up the pyramid here to the minimally invasive procedures, things like injectable products and laser procedures. Patients that come to see me for consultation, I want to give them the most comprehensive consultation possible upon seeing them, and everyone who sees me gets those 2 important points, right? What were the 2 important points I want you to remember from the lecture? Everyone who sees me, even my skin cancer patients, hear that too. I'm sort of like a broken record, but there are other things that we want to address. So if you have a cosmetic concern, there are really 3 things that I would want you to think about, and we sort of discuss together as we develop a relationship. 1, does your cosmetic concern bother you? You would say, well, if it's a concern, it should bother you, but we'll touch on this point in a minute, because this really focuses not just on how to care for the skin, but why you should care for your skin. 2nd, what are your expectations? There are many patients, the first thing we sit down in the room, a patient will say, I would like this. And that's not to say that, there's a point here. The facial anatomy changes, and there are ligaments along the jawline, and any of the minimally invasive procedures that we do does not address this ligament and this excess skin here. You need a more invasive procedure to address this. And so it's important to understand if you're looking for something that is a lunchtime procedure where there's minimal downtime, but you have expectations that fall within the realm of what is possible, then we can talk about many of the procedures I'm going to discuss in a moment. And then finally, can you tolerate social downtime? Because that will influence where we can steer the treatments. So let's focus on the first. You know, does your cosmetic concern you? Well, why are folks doing cosmetic procedures? We talked about some reasons why. This is a quote from Time magazine. It says that we're buying beauty because it makes us feel better about ourselves. But how true is that? This is a gentleman who came to see me with a quote-unquote cosmetic concern. He has an issue called rhinophyma caused by rosacea. This is considered cosmetic, his concern, but it impacts his life. He goes about and says he doesn't feel the way he looks, okay? And we were fortunate enough to do one sculpting procedure with an electrosection, and this is 2 months after the procedure. He feels much more like how he feels, okay? And he feels how he looks. And that's important to us because I believe that many of these cosmetic procedures can help with that, help with the quality of life and self-esteem. So this is where the 3rd aspect of my practice is within the division and the department. Teaching and research. We train residents, we train fellows to do the procedures that we do, and we also focus on trying to advance the field of dermatology and dermatologic surgery. So within cosmetic surgery, there have been a number of papers published recently to show that cosmetic procedures can have objective improvements in appearance. This is a study published in the Journal of the American Medical Association where they basically took photos of patients who had plastic surgery. These were invasive surgical procedures like facelifts and eyelid lifts. And they asked folks who had never really seen these patients before, just folks off the street, to say, look at the before and after. Does the person look more attractive? Do they look younger? And if they look younger, how much younger do they look? And with these invasive procedures, what was shown was that the perceived impressions improved after the facial cosmetic procedures, and this is consistent with the whole wealth of literature prior to this. The thing that's surprising, though, is that what objective lay people described was a change in about 3 years, and this is with facelifts and more invasive procedures. So when patients come to see me, I absolutely say I cannot take years off of your appearance, but we can give you a refreshed appearance, make you feel, or make the appearance look less fatigued. And if that's what you're looking for, it's something that we definitely can offer with the minimally invasive procedures. But this intrigued me. So my colleagues, myself, and some of our colleagues in psychology and plastic surgery, we tried to look and see, do cosmetic procedures impact patients in other ways? And so we looked at all of the literature over the past 20 to 30 years and to see how can plastic surgery and cosmetic procedures change patients beyond just their appearance. And what we found was that there's only about 16 studies that have been done over the past 20 to 30 years looking at, do changes in quality of life or self-esteem or body image change with these procedures? And it's sort of staggering what we found. In the past 14 years, with botulinum toxin and soft tissue fillers, the number of cosmetic procedures has increased by 9 to 10 million, okay, over that period of time. There's only been one study analyzing what these cosmetic injectables do. That's staggering, and I'll touch on this in a moment. Many of the studies, those 16 studies, showed that and these are studies that we would consider fairly well done. Many of them had weaknesses, but there may be improvements in body image, quality of life, and self-esteem. And this is consistent with my experience. Many of my patients will come back a couple of weeks afterwards and feel better about themselves. And this is why we're passionate about this. We want not just to improve the appearance, I feel like we're helping health in general. Many of these studies are weak, and so what we've done over the past 3 years, my colleagues in psychology and plastic surgery, we've enrolled patients trying to determine, are these cosmetic procedures impacting patients beyond just their appearance? And what we found is that patients who are seeking these treatments are highly educated. Many of them have college degrees. And many patients are seeking these treatments after a major life change. And that could be marriage or divorce, death, a loved one, or trying to work their way up in a new position at their job. And what we also found in surveying the patients is that the media and friends are probably the major influence of determining whether or not patients will come seek for treatment. The eyes, the cheeks, and the neck are probably the most common concerns that we see here at Penn. And what we're analyzing the data right now. I'm not going to give away what we found, but it really is intriguing, and it's likely going to lead us to do additional studies beyond this, and we're going to publish this in a journal. We've been fortunate enough to gain funding from our Center for Human Appearance, which is a constellation here at Penn of dermatologists, plastic surgeons, otolaryngologists, oculoplastic surgeons, and psychiatry. Okay, we're going to move on to the second question of what we'll discuss in a cosmetic consultation. What are your expectations? I'm not going to show photo after photo of what plastic surgery can do, but what I think these two photos demonstrate is that appreciation of aesthetic principles and anatomy is very important because procedures can leave patients not looking like themselves. And this is something that we absolutely will not allow to happen. So how do we not allow that to happen? Well, we try and identify where in the skin the concern is. Because if there are freckles on the skin, it's different than if there's a wrinkle on the skin, and we try and target things in different ways. What do I mean by that? Well, if we see here, here's the skin, and we've got the upper part here as the epidermis, just below it is the dermis, then there's subcutaneous tissue, fat pads, and then muscle below that. And each of those layers we can change or impact in different ways to positively influence the skin. Here's a young patient who had just one little crease in between her eyes. This is, a scowl line, a little bit of botulinum toxin, keeps the muscle active, but it relaxes that line and causes what I consider a subtle change, but a good improvement for this patient was happy. Patients that are a bit more matured, botulinum toxin is another good way to soften many of those lines. This is a patient after soft tissue fillers. Now, it's not a dramatic change, but the smile lines, what some call the parentheses, are improved just with a little bit of hyaluronic acid injected there. Similarly, this is 1 month after botulinum toxin, a small amount in the lips combined with hyaluronic acid filler in the lips. Acne is something that is fascinating because the signs of aging actually can accelerate the changes of aging. The collagen is weakened. So this is a patient who had multiple sessions with polylactic acid, and you can improve the scarring, which sort of worsens with age, as well as many of the lines on the face. The tear trough is probably the first thing to change on a face. It usually happens in the 30s, and a little bit of soft tissue filler underneath, small amounts, in specific planes can lighten the shadow that happens underneath the eyes and result in a pretty dramatic improvement. Males also have these procedures too, and this is something that we've shown in multiple studies. Third question, can you tolerate the social downtime? All of the procedures that I just showed, the botulinum toxin and soft tissue fillers, those are lunchtime procedures. There is a risk of bruising, there's some other very remote risks, but for all intents and purposes, they're procedures that can be done in a short period of time and have minimal downtime. There are other laser procedures that can be done with minimal downtime. This is a gentleman who had a few sessions with the pulse dye laser to reduce the redness in some of the broken blood vessels on the face. Similarly, this is a patient who had a sunspot. With just two very easy treatments with no downtime, the sunspot was changed. But for patients who have more wrinkles on the face, to do procedures that are minimally invasive with no downtime, it's unlikely to result in significant objective changes. So for these patients, we do a resurfacing procedure that takes a week of downtime, but does result in what I would consider a significant improvement in the facial wrinkles. Yet another patient here who both had filler injected as well as a resurfacing procedure. You can see that the laser improves many of the wrinkles and the sunspots. The filler changes some of the deeper lines as well. The sunspots, this is another patient with a resurfacing procedure to improve the texture and sunspots. And then yet another example of acne scarring and how the aging process is accelerated by the weakened collagen. And this patient required 2 resurfacing procedures, but there are very few things that can achieve those results other than that. So let's circle back around and recap. We've got sunscreen, which is one of the 2 important points that you have to take from this lecture, right, along with the cessation of smoking. As we move up this pyramid, prescription topical retinoids can help, and then beyond there, we have these minimally invasive procedures. I haven't touched on things like sclerotherapy or chemical peels that sort of doesn't hit home on the photoaging, which we've emphasized during this talk, but I'm happy to address during the question and answer session. And then finally, surgery. Surgery is something that, again, we have fantastic collaborators within our institution, and I refer them patients if I feel that the procedures that I offer can't offer the changes that our patients want. I'd like to end on a note. Again, this hits home on why it's important to take care of the skin. This is a program that is being sponsored by the American Society of Lasers and Medicine and Surgery, which I'm a member of. If you happen to have friends, family members, loved ones who have had radiation for cancer, regardless of the location, we have many of these lasers that can remove the tattoos, and this is something that we're offering free within our division. So please spread the word. Radiation tattoo marks are tiny little dots. They may not necessarily be a cosmetic concern, but they can be reminders of the treatment, which can have a psychosocial impact on those patients. So they can go to the aslms.org website, just type in the zip code, you'll be able to find us here. So thank you.